Hi, my name is Frances, and I'm going to be your nurse today. Can you tell me your name and date of birth, please?
Robert Wheeler, 11/10/1995.
Any allergies, Robert?
Penicillin.
Penicillin. We'll make sure we don't give you any. Hey, it's time to do your assessment, and that's going to involve me putting my stethoscope on you and having you perform certain tasks as I indicate. Is that okay?
Mm-hmm.
All right. Alrighty. How are you feeling today?
Pretty alright, how are you?
Good. Any pain anywhere?
Mm-mm.
Good. So, Robert, first I'm going to have you just let me show me your hands. Thank you. And all right. And I'm looking for cap refill here. Good. And then just squeeze my hands real hard. You can't hurt me. I always present my hands with my fingers like this. If you present them like this, even the nicest person will crush your hand. So always present like this. Okay? So squeeze, squeeze, squeeze. Very good. And then now I'm going to just feel for your pulse here in your wrist. So what happened here?
Just surgery.
What kind of surgery?
I had 2 dangling cysts that was removed when I was like 13.
Okay. And that affected your radial pulse?
Well, you can feel it on this one, it's just it's just impossible.
Is it closed?
It's just really scarred in there. Yeah.
They're equally warm, so touch each finger to your thumb. Okay, and then if you can hold out your arm for me. And so here you're looking for, oh, what happened up here?
Track injury.
Nice. All right. Make a muscle for me. And then your brachial is right here under that bicep, okay? This side. Let me just look at your arm. More track injuries?
Something like that.
That was a rough sport. What did you do in track?
110 300 hurdles and the 4x4.
Oh yeah, that would include a lot of falling sometimes.
Yeah.
I'm sorry. All right. So bend your elbows and shoulders. And roll it all around. Good. Good. Any issues? Okay. Perfect. Smile. If you smile at your patient, they smile back. And that's one of your cranial nerves. Okay. So now we're going to go ahead and assess your head. And do you have any cuts or scrapes or lesions that you know about?
Hope not.
Good. Looks good. No issues there. I'm going to just take your eyes out. Your eyes are the most intensive one, okay? So if you want to pull this back up, because you have reflex, cranial nerves, and function to consider, okay? So reflex is your pupils. If you'll just look at my forehead, please, and you can localize the pupils, and then all you're looking for is movement. The first time you're looking at this eye, the second time you shine it in this eye, but you're looking at this one because your pupils should move together, okay? So that one moved as well. So now I'm going to look at this eye, and then this eye, and it's moving beautifully. All right, now follow my pen, the tip of my pen. I'm going to use his nose as my center, and then I'm going to do an X and a plus sign, okay? So the diagonals are a separate cranial nerve than the up and down and the side to side, okay? That's why you have to do it. Oh, don't move your head, just side to side. There you go. Different cranial nerves. Very good. Now for function. So those are your cranial nerves. Your eyes are supposed to see, right? And we have to assess frontal as well as peripheral. Think of your glaucoma and macular degeneration patients, okay? So, can you read these big letters?
Galen College of Nursing.
All right, little letters.
MSNRN.
That's right. All right. I worked hard for that one. Now we're going to do your peripheral vision. If you'll cover one eye for me, and then tell me when you can see my hand.
Yeah.
Good. Other eye. Go slow.
Yeah.
Very good. You have excellent peripheral vision. All right. So now I'm going to just take a look at his ears. when you're looking at the shell of the ear, you're looking behind it as well. You're looking for critters or bruising, and then CSF leak as well. Critters can come out of the canal or be living behind the ear. And then cover this ear for me. Can you hear that?
Mm-hmm.
Okay, great. And that's the function, right? So this ear, again, you're looking at the shell, you're looking behind, and you're looking inside. Very good. And then cover this ear for me. Can you hear that? Good. Some patients can hear loud, but not a little bit. And it's amazing how loud that can be when it's right up next to you, but it's very quiet for everyone else. Now I'm going to look at your nose, up, up, up. And you're looking for a septum and if it's deviated or not, right? And then function. Close your eyes. What do you smell?
Alcohol.
Yep. All right. And now your mouth. Say, ah, nice and big. Good. And then move your tongue around a little bit so I can see your teeth. Good. And then stick out your tongue and then side to side. Very good. That's its own cranial nerve as well. Okay. So, and then swallow. And then open up again. And what you're looking to see is if they were able to swallow any spit they had. So it should be nice and clear after they swallow. All right? Now, say no, real big. I want to see your full range of motion.
Awesome. Shake my head too?
Shake your head, yep.
No.
Say yes, real big.
Yeah.
Good job. That's also part of that, okay? So very, very important. Some assessments have you hold your hand there and they're supposed to push against it, but that doesn't show me what their range of motion is. And we've all slept wrong, right? Just like, oh, I can't turn this way, but I can go all the way this way, you know what I mean? So I want to see what they can do, and I don't want to potentially hurt them, okay? So I'd rather him show me his full range of motion, saying no, and then saying yes. Do that again, nice and slow. Yes, and then no, nice and big. Very good, and he has a wonderful range of motion. I didn't have to put my hand on him, okay? So now I'm gonna break out my stethoscope. And we're gonna start at the neck. So go ahead and slide down and lay down. So look, listen, feel, right? So first things first on the neck, at 30 degrees, we can look to see if they have JVD. And he has no JVD. Okay. So let's listen. I'm gonna listen to his carotid for a bruit. And there's none. And then I'm listening to his trachea. Breath in and out. Beautiful. And then I'm gonna just feel for that carotid. And that does have to be one side at a time. There it is. Okay, very good. And now I'm gonna listen to his heart. Would you be a dear and take off your shirt? Nice tattoo.
Like a mug.
So here, you do need to verbalize the suprasternal notch, okay? And that is that wonderful little divot here where the clavicles come together. Then, and you can look at it on this wonderful skeleton man, you see this kind of this cravat looking or upside down triangle looking bone, which is the top of your sternum. And where it comes together is your second intercostal space. Okay, so that's your angle of Louis. So the second intercostal space, then you start on the right. And that's your aortic valve. On the left is your pulmonic. Erb's point. Tricuspid. And then mitral. Now that's also your apical pulse, and for the apical pulse, we're going to have them just kind of put their hand on their chest. And what we want to do is just correlate this heart, lub-dub that we're hearing to the pulse that we feel. In theory, we do that for a minute, okay? In practice, we correlate and then we're done. If it's irregular, then you do it for a full minute. His was beautifully regular. So, the acronym for that is All People Enjoy Time Magazine. Okay? Say it.
All people enjoy Time magazine.
All right. So for the ladies, there's a breast here, right? And so what we have them do, just pretend you have a boob, is hold it up for me, okay, so that I can do this. Okay? Now, if the person is able to hold up their own breast, wonderful. If they're unable to, then we use the back of the hand, because it's not a cupping caress, it's a procedural, I need to listen, and this is in my way. Okay? Now, some of your very larger, older ladies, you don't have to worry about it, because guess what happens? Gravity always works, right? Right? And they lose their plumpness as we age. So, sorry guys, you didn't know about that. So you can just still be right here and you're fine, all right? So it just really depends on the breast. All right, so now we're gonna listen to bronchial, bronchiovesicular, and vesicular sounds. Just take some deep breaths for
We're gonna be
me.
taping it for you, so I wouldn't be recording. I'm sorry. Delete it, so that you can actually not have your fellow person on your phone. You may not want it to be distributed.
That's cool.
You don't mind if it goes worldwide?
Yeah, you good?
CNN?
Or vesicular.
I hope so.
All right, I'll do his back assessment in just a minute. I'm gonna keep going, those sounded clear. So bronchial, bronchiovesicular, and vesicular, and they do sound very different. Then we're gonna start with the abdomen, and again, the look, listen, and feel approach, okay? And here I can also see that he's moving both sides of his chest. He's obviously not in respiratory distress. You know, he's not using his intercostal muscles. Everything looks fine. So we start at the right lower quadrant. Okay, so I'm gonna have you just jimmy down your shorts a little bit. All right, perfect. And I'm gonna start in the right lower quadrant. Why? Huh?
It's where the ileum is.
That's where the ileum is, that's right. That's where the small intestine meets up with the large intestine, and there's always chyme coming through there, so we should always hear gurgling. You listen until you hear a gurgle. And then function. When was your last bowel movement? And you can say today or yesterday or.
Yesterday.
Okay, perfect. Good job. No problems with your bowel movements being regular or whatever? Okay. So now I'm going to come to the bottom of the bed. And I'll just have you pull up the desk. You do have to come to the foot of the bed to do your leg assessment. And the reason is, the reason is because you cannot assess for symmetry from the side. And symmetry, you're looking for everything coming down at an equal length. Is this leg shorter than this one?
I don't think so.
I'm just checking. Mine is, because I broke my femur, so I'm just checking. They're a little off.
Oh.
They really are. Okay, anyway, there's no swelling. You check for that. You just gently push, put your thumb, and then you push. Gently put your thumb, push. And you do it right alongside the tibia, so you want to be gentle. But he has no swelling. And then down here, what we're gonna do is assess for those pulses first. Now it's halfway, very technical terms, between the bend in the road and the tootsies, okay? So every patient's a little bit different, but if you go about halfway, there they are. Yep, perfect.
Awesome.
And set your fingers gently there, it'll pop up to you. Now, go ahead and open up your legs for me. Your posterior tibialis is on the inside, right above that calcaneus. The fastest way to flunk your assessment is to look for this out here. So that means you didn't practice at all. Okay, it's on the inside. And there they are. It's very well protected. It's intended not to get splashed on accident, okay? So now let's look at sensation and function. Can you feel my hands okay here?
Yes.
Okay. And then can you wiggle your toes? And then look in between the toes. And then you're gonna check cap refill down here, and you check it on the fat pad, okay? Because people either have painted toes or they have fungal toes. You actually don't, you have beautiful toes. It's wonderful. So I'm gonna lift this foot up because I need to see the bottom of this heel. Wonderful. Now go ahead and bend your knee for me. Bend this knee, and then just drop this. Good. And then up, and then drop it. Any problems with your hips? And then bring them back out to me. Very good. Now, don't let me push them. Don't let me push them. Okay, so I checked adductor and abductor, his knees, right? And then his hips. Do you see how that happens? Now, in the hospital setting, this is also an excellent way to see the bottom of their legs, the bottom side or the back side of their legs, to see if everything's intact down here as well. Because remember, gowns, you see everything, right? Okay, very important. So, very important. We are deferring the genitalia for your exams, okay? But in the hospital setting, you would absolutely look at their genitalia also, especially for yeast, that redness on their skin. For women, it could be cottage cheesy looking kind of stuff inside their labial folds. And then, of course, for men, you also want to assess under their scrotum and stuff. And again, you do the back of the hand kind of business to move things around so you can see real quick. And then you have to have the where is your foreskin conversation, okay? Some men, it used to be 50-50, now it's more like 40-60, aren't circumcised, and so we have to be very careful with that care for the penis because they stop cleaning themselves. So that means we have to, right? And they can actually get an infection down there. And then the other one is if we retract their foreskin to clean and put in a Foley, then it's our job to protract it back over the glans. And if that doesn't happen, then the glans can actually get strangulated and turn black and have to be amputated. And let me tell you, that is a non-delegable function, and that is an RN function daily. And if we don't do it, the hospital just writes a big check. And nobody gets a raise. Rats, okay? So very, very important to know and have that conversation. And ladies, if you haven't had your sons yet, it is not a cosmetic procedure. It is a cleanliness and hygienic procedure, and please get it done while they're babies. Okay. All right, so bring it back. Now I'm going to have you put back your socks on, and you can dangle on the side of the bed, please. Now, since I touched his feet, I'm going to just change up my gloves, because now I'm going to do his back side. So wear short socks, okay, on the day of, so it's easy to come on and off. All right, so here I can see the back of his head a lot better than I could before. And that's an important assessment for anybody on bed rest. It's amazing how fast they get a sore. And then here we're gonna listen to 8 spots. And it's not on the spine and it's not on your scapula. It's in that sweet spot in between, and you follow the scapula, okay? And here we do it a very specific way. So we assess the top, then the middle, then the bottoms at the same, or right after each other. So taking a deep breath and out, again. So we go lateral, then we drop. Again. Again. And then we do mid-axillary. Just lift up. Deep breath. And deep breath. Now the mid-axillary one you can do from the front on men, but for women it's easier to do it from the back for obvious reasons. And so I just did it all here for that purpose. All right, so I'm done with my stethoscope. Go ahead and stand up for me, and then turn around, and then dangle and touch your toes. So here what we're doing is, don't touch your toes quite that well. Okay, beautiful. We're looking for that scoliosis to see if he's, this is a little tired with this side. Did you know that? You're very tall. That might be part of it. So, no, he actually is a little bit. Do you guys see that? Mm-hmm. Yeah, it's kind of funny. And again, this is the one you also have to be looking at it dead on. Is this Aslan? Or is this a Gryffindor lion?
That's God.
Oh, that's so cool. Perfect. Okay.
Lie down. Alright.
Okay. So now,
Yeah, I know.
oh, okay. So I'm not imagining this.
No.
Oh, okay, good. Shoo. Shoo. So now you can put on your shirt again. Thank you so much. So now I'm gonna have him actually go void for me. I forgot this part of this. So when they're laying down after their tummy, then you're supposed to press on their bladder. I forgot to do that. But go ahead and go void for me. And while you're walking, and then just walking over and back and forth, I'm assessing their gait. And he's very steady on his feet. Come on back, and then just have a seat. Wonderful. So here, just like a diamond, I'm looking at their color and clarity, right? So very important, and no sediment. And then did you notice any foul odor when you voided? Was there any burning or anything when you voided? Okay, perfect. Now the last thing, I have one thing left to do, and that is the sensation. And for this part of it, I do not need gloves, okay? So I'm just gonna, because I'm gonna be using a cotton ball and a cotton swab. Now, I'm gonna go ahead and show you what I'm gonna do. Pull up your arms and pull up your pant legs. This is why you have to wear shorts, guys. It's just, and short sleeves. All right, so I'm gonna do this on you, and you're gonna tell me if it's hard or soft. This is soft, and this is hard. And where? So forehead, cheek, arm, legs, right or left. And if you haven't mastered right or left yet, now's your chance, okay? So close your eyes and tell me what you feel.
Soft right cheek.
Okay?
Hard left forehead. Soft left cheek. Hard right forearm. Soft right hand. Soft left forearm. As far as
The calf or your shin.
shin, there we go. Right shin, hard. Soft calved left.
Yes.
Hard shin, left.
Yes.
All right.
That works. And I already did his feet when I had his socks off with my hands, okay? So, three areas per section. And again, left or right is gonna be your biggest challenge there, so, very good. Robert, you did fantastic. All of my findings were normal, except for your scoliosis.
Yeah, my leg's apparently smaller.
And a little shorter, and then this radial pulse is a little sketchy, but you knew about that, so, so I don't think we need to sound any alarms
Not yet.
or anything like that. Good job, thank you very much. All right, so now you can see the importance of the clothing I recommended. Again, socks that are easy to come on and off, stretchy shirts so you can get your stethoscope on your skin if possible, and move things around. So you only have to expose what's needed at that moment. Like you're just, okay. Any questions?